Most radiotherapy is administered using a large X-ray machine called a linear accelerator. They work by giving a short external beam directed at the affected areas. Radiotherapy can be used alone as a primary treatment, but it is also used as a secondary treatment. It can be used not only to destroy the tumours, called radical radiotherapy, but also to shrink them and reduce symptoms. This is known as palliative radiotherapy. The length of treatment will depend on why it is being given, and this will be decided by your healthcare team. Planning of the treatment is quite detailed and can take 2 to 3 weeks to sort out. The first part is a CT simulator, which X-rays affected parts of your body. The purpose of this is to work out the exact positioning to get maximum results. So the radiographer often takes their time in getting it perfect. Once the initial scan is complete, the radiographer may apply a small permanent blue dot, no bigger than a freckle, so that they can make sure you are in the right spot every time. Treatment doesn't hurt at all, but the machine can be loud. Radiotherapy is nearly always given on an outpatient basis. It is sometimes given as an inpatient if you are also having chemotherapy or are too unwell to travel. You'll be placed comfortably on the treatment couch and positioned correctly using the new blue dots. Only the part of the body that is being treated will have to be undressed. Remember, radiographers are not only there to administer your treatment, but also to make you comfortable and put you at your ease. Once the machine is positioned to the correct angle, the actual treatment only takes 10 to 15 minutes. The radiographer leaves the room to activate the control panel and monitors you via CCTV. Once your treatment is finished, your healthcare professional will arrange to see you a month or so after your last treatment. Should you feel unwell in the meantime, contact your lung cancer nurse for advice.
When you go into radiotherapy, the first stage is the planning. They are zeroing in on your tumour, so that they can find the same place every time.
And I had to go for 17 days every day for radiotherapy. Apart from the weekends, you know. So it was like just over 3 weeks I had to go.
You're laid on a machine, which is a bit like a scanner. In my case, semi-naked, because I was stripped to the waist, and there are all sorts of laser lights going with. You're being lined up, the machine's being lined up, because again, they're very careful that they only want to zap the tumour itself. You get the sense that you should feel something happening, but in fact, you don't feel anything.
The treatment was nothing, I thought. It was only like an X-ray, you know, and it only lasted. You'd go, if your appointment was for 10 to 10, you'd be out by 10 o'clock. Because they had slots, you know, where you were there, and they did brilliant, absolutely brilliant.
The machine itself would actually make a noise when it stopped, and I used to call out, "I'm done, I'm cooked." Sorry, so just come back.
Yes, after I'd had the radiotherapy, I had all the side effects what they tell you about, you know, to expect.
Do you know the one I remember the most? When you couldn't maintain your body temperature. But yeah, that was the one I remember. And for days and days and days, it was the middle of winter, but you'd have 3 or 4 layers of clothes on. Mm-hmm. So cold.
I sit under my blankie.
Sit on your blankie, yes. Absolutely freezing. And then there was the delights if you were hungry for a second.
Oh,
if
yes.
you didn't eat in that second, that was it. You couldn't eat.
Yes, would have an appetite for.
Yeah.
And he's like, feed me. Too late.
I had trouble with my throat, which they thought it could be a bit of scarring from the radiation. But I wasn't unduly happy about that. I just went from being a soprano to a baritone, you know, and not as sweet talking as it used to be.
So let's have a recap. Side effects of radiotherapy can vary. The most common ones are tiredness following treatment. Don't worry, this is quite normal. But if you're having difficulties with it, let your lung cancer nurse know. Esophagitis is an inflammation in the gullet, which can make it painful to swallow and cause a tightening of the chest. This is only a temporary side effect, but soothing liquid medicines can be prescribed. You may find cool drinks or ice cream also help. Scarring of the lung, also known as fibrosis, may happen. You may notice a slight increase in breathlessness. If this becomes a problem, tell your lung cancer nurse, as there are medicines and breathing exercises which can help. You might find an increase in your cough. Don't worry, this is quite normal and can be treated if necessary. Your skin in the treated area will become a little pink or red. It may also feel a little dry or itchy. You may bathe or shower during treatment, but don't have the water too hot. Wash gently using mild baby soap and pat the area dry with a soft towel. Use only prescribed creams and avoid talcum powder or lotions. Whichever of these 3 treatments are prescribed, everyone's side effects and recovery time will be different. Try to stay motivated and focused by remembering why you are doing it.
Survivorship starts the same time as your treatment starts. The medical practitioners will do everything that they can possibly do to help you. But you have to fight. The patient has to fight, which is why I said I called mine Carol. I called her worse than that. But it demystifies what's happening to you and gives you a point of focus.
Treatment duration can vary depending on the stage of your cancer. During your diagnosis, your healthcare team will discuss this with you in greater detail.